So welcome everybody. I'd like to thank you all for joining us at our first Cochrane Library training session. This is the basics session, so if you are here to learn basically about what Cochrane is and some of the basic functionality, you're in the right spot. As Robin said, Robin Parker from the Kellogg's Health Sciences Library is our leader today. She will be walking us through the Cochrane Library, and she is based, as I said, at the Kellogg Health Sciences Library at Dalhousie University. Thank you very much, Robin, for doing this for us. And first, I'd like to start with a brief acknowledgement that we would like to acknowledge that Dalhousie University is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. And we thank them very much for allowing us to use their land. I did want to also mention that this, as Robin has already mentioned, will be recorded and it'll be put up on the CAAL website, and I will send out an email to everybody who registered telling them when it is uploaded and when it is available. I will also be monitoring the chat. So if you have any questions that you don't want to speak up and say, I will just type them in the chat and I will relay them. Anyways, other than that, we are ready to go. And take it away, Robin.
Great. Thank you very much, and Cynthia, and thanks for the invitation to offer this this basic overview of the Cochrane Library. As you noted, this will be just some basics and kind of what's in it and how to navigate it. As Cynthia noted, I work at Dalhousie Libraries. My pronouns are she, her, and thank you for the acknowledgement for the land that we work on. And so want to also just kind of a brief disclaimer that I am a member of the Cochrane Collaboration and have attended the COCRIA for a number of years, but I don't receive pay from either Cochrane or Wiley, the platform that publishes the Cochrane Library. I did receive a small honorarium for assisting with some training a number of years ago, but I wanted to make sure that it's clear that about any potential conflicts of interest. So what I want to talk about today is just to look at what is the Cochrane Library, as noted. We'll also go over what the types of information are that are in the library, how to do some basic searching, and how we'll talk throughout about who would maybe find this useful and what they would find it useful for. So, to kind of break the ice a little bit, I wanted to start off with a little bit of a poll. And I know this might be a little bit basic, but it's basically asking you to participate in the poll and let me know what type of organization you work for. And if you select other and you want to put that into the chat box, that would be great. What other type of organization you are. I was trying to think of what categories there were briefly last night, and I'm sure I missed some. Great, so we've got 37 out of 38, which is probably me that's not there. So we're almost half of us are from academic institutions, academic libraries, quite a few folks from hospitals, and welcome to all the folks from public libraries or services. I'm glad to have you here as well. And I didn't actually share that with you. So now you should be able to see that the results of that poll to kind of get a sense of that. So thanks for participating. And confirming that the polling works. So briefly, I want to talk really quickly about kind of what is the Cochrane Collaboration, because that helps to make sense of what is what's the Cochrane Library and where it comes from. So the Cochrane Library and the Cochrane Collaboration are named after Dr. Archie Cochrane, who's a UK scientist from the last century. And he was one of the people who noted that, clinical practice, when we talk about healthcare systems, really ought to be based on reliable information, and preferably that it's been synthesized together so that we have really confidence in what the results are and whether or not the practices actually work. So the colloquium and the collaboration have been around since '93, so 16 years. And they've been producing the Cochrane Library since 1995. So back in those days, it was first produced on CD-ROM. It is an international organization that mostly consists of volunteers, academics and clinicians who work to produce systematic reviews. And I'm just going to really, really briefly touch on what are systematic reviews. So some of you will be familiar, but basically the systematic reviews, such as the ones that are produced by the Cochrane collaboration, are a robust research methodology that has a really clear scientific and systematic approach. And that's kind of contrast with the traditional reviews or reviews that might be done a little bit more informally and are often done to kind of address a general question or provide some background information on a topic. So systematic reviews, the methodology that's been really promoted and refined by the folks at Cochrane, do attempt to usually answer a very specific, often clinical question, at least in the context of Cochrane, and try to reduce bias at all of the steps in order to come up with a more specific answer. So, and the benefits of that are that the estimate of, especially when we're talking about treatment effects, is going to be more precise. Because the systematic review pools the results of multiple primary studies, it can help to increase the generalizability of those results. And also sometimes these systematic reviews will just demonstrate that there maybe isn't all that much good evidence in a particular area. So when we're talking about Cochrane reviews, often what we're talking about are reviews about interventions. So what works in terms of a therapy for a particular health condition. There are also a number of other types of reviews that are included in Cochrane Library, and I'll show, and there's a bit of details here, but I'll show a little bit about what that looks like in terms of what's in the Cochrane Library in just a moment. So there are reviews of diagnostic test accuracy, some reviews that look at some of the methodology issues around producing systematic reviews, a few qualitative reviews, and a couple of prognosis reviews about the course of the disease. Which takes us right to what is the Cochrane Library. Sorry, I just realized I hadn't stopped sharing those poll results, but I hope they weren't in the way. So what is in the Cochrane Library and who might want to use it, which are two really closely linked questions. So first of all, as I noted, for the most part, most of the reviews and most of the products that are in the Cochrane Library have to do with this question of how to treat or prevent particular health conditions. So the Cochrane reviews and clinical trials and the overviews all have to do with that. But also there are some diagnostic test accuracy reviews and prognosis and qualitative. So who might want to use these? These could be questions, could address questions that come up from the public. For example, if somebody has been to see their doctor and the doctor has mentioned a particular treatment or a particular way to prevent a health condition from developing, maybe they want to have some more information about that. And so they could look at the Cochrane Library to see whether, for example, maybe they are wondering whether cannabis or marijuana could be helpful for treating chronic pain, for example. And so that could be a question that they might want to look at. Likewise, for clinicians and various healthcare professionals of various types, dentists, physical therapists, folks working at nursing facilities, doctors, nurses, all kinds of healthcare professionals. They might want to make sure that the practices that they're doing in their treatment are really based on the evidence, that they want to be practicing evidence-based healthcare. And so they likewise would maybe want to see, what is the evidence for a particular treatment, or what is the evidence for using a particular approach to diagnose a condition. So another question here. So see whether you feel like you can address this question. Based on what I've talked about so far. Give a second to answer the question of which of the following questions could be answered by the information in the Cochrane Library. First option is, what are available treatments to help people quit smoking? And the second option is, does the patch, otherwise known as nicotine replacement therapy, help people quit smoking? Just give a moment for a few folks to think about that and respond. I haven't talked about this in big detail, but I would agree with the majority of folks that the Cochrane Library, the evidence in the Cochrane Library is better for addressing specific questions. So as noted, systematic reviews aren't so much about giving a broad overview as addressing a specific type of question about often about a therapy and whether or not that works. So a question like, does the patch help people quit smoking? I think we could probably find an answer to that in the Cochrane Library, whereas all of the treatments for people who stop smoking, there might be an answer in there, and I'm going to talk about some of the overviews that are in the Cochrane Library in a moment. But that type of question is not as helpful, not the best approach to take when looking at the Cochrane Library. Any questions about that? Feel free to chat in the chat box. And just as a comment, I'm looking across 3 different screens for the different functions of this presentation that I'm doing. So I apologize for not always kind of watching the screen or the camera.
Just 1 second, Robin.
Yeah.
In the chat, somebody had mentioned that the question and options didn't show up on their screen, just the results.
Okay. It's possible that the poll box maybe got behind a different window that was open. That's my only thought at first. I don't have any other thoughts about why that might not have shown up, but it's okay. The polls aren't crucial, and just to make sure that everyone's kind of staying on track with me a little bit. But thank you for the feedback. So another way of thinking about the type of information that is in the Cochrane Library is to think about, there are a number of different types of information products that are within this this interface, because it actually holds multiple databases. So I'm going to talk about that in a moment, but one of the ways in health information we talk about evidence is some levels of evidence based on the amount of summarizing that's been done. And so as you move up this pyramid, this Heinz 6S model, it takes less time for a reader to make sense of things. It takes less work to make sense of things, but there also are less questions that are actually addressed and less evidence that's provided. Whereas as you move down the pyramid, it takes more time and more effort to make sense of the results from a search or what evidence you pull up. But there's a lot more evidence there. So there may be information that is not at one of those higher levels. And the Cochrane Library itself has single studies that I'm going to talk about in a moment where those are found. It has syntheses, which are the reviews, as I've talked about, systematic reviews that are in the Cochrane Library. There also are some summaries or synopses of these reviews, and as well as what is called summaries in this table or in this pyramid, which are kind of overviews of more broadly of a topic that summarizes maybe multiple pieces of evidence, including multiple reviews, and kind of gives that overview. So in the context of the Cochrane Library, what we'll see in a moment is those summaries are in the form of Cochrane special collections that are kind of pulled together by experts to give an overview of a question, possibly like, you know, what's the best methods for quitting smoking. There are summaries or synopses of the reviews in the form of the Cochrane clinical answers. These are some really brief versions of the reviews that highlight the bottom line of what are the results. And then in terms of reviews or syntheses, there is the Cochrane database of systematic reviews. So these are the reviews produced by members of the Cochrane collaboration. And there are also a link out to a database of additional systematic reviews that are published elsewhere in the form of a database called Epistemonikos. So the Cochrane Library also includes single studies or primary studies that are specifically controlled clinical trials, and these are in the central registry of controlled trials. In addition, there are some pieces of information in the Cochrane Library that are kind of what would fall below or outside of the pyramid, which would be expert opinion or commentary, and these are Cochrane editorials. Although in fact, they're not necessarily not evidence-based, because these are commentaries on the evidence that's presented elsewhere in the Cochrane Library. So if we jump over into the Cochrane Library, I'm just going to show you, before I actually enter the interface myself and show some searching, I wanted to just show that as of yesterday, kind of a little bit of the scope of what's here. So we see that Cochrane reviews, there are almost 8,000 of them at this time in the database. There are also several thousand Cochrane protocols. So these are the plans for a Cochrane review that are published before the final review is actually finished and completed. But these are there so that people know that the projects are planned ahead of time and that they follow that plan. And then there are over 1.5 million trials included in central registry of trials. So this is something where you can also find trials, for example, in PubMed or Medline or other databases. But what's unique about the trials in this in central is that these are specifically controlled clinical trials. So in other databases, there'll be a mix of different types of studies. There'll be case studies, and there'll be observational studies, and there'll be editorials and letters to the editor and all kinds of different things. In this case, this is a curated list of only clinical trials. So it's actually the largest single source of trials to go to. And those are pulled from sources like PubMed and Embase, as well as clinicaltrials.gov and other clinical trial registries. We see here that there's a number of editorials, over 100 editorials, and a handful of these special collections, these kind of summary resources that I mentioned. And then almost 2,000 clinical answers, where these are Cochrane reviews that have been prioritized to, and an expert has kind of pulled out the really crucial information for easy access for clinical practice. And then there's this link here that links out to Epistemonikos, that source of additional systematic reviews. So in these sources, it's really important to note that not all of these are full text, even on the full version of Cochrane Library, like we now have access to across the Atlantic provinces. So the Cochrane special collections, these are full text, and as noted, there are a few records, relatively few. Clinical answers are also full text, and these are pretty brief bits of information, much shorter than the full Cochrane reviews. And there are some records, and those are increasing as prioritized by the Cochrane Library. the Cochrane database of systematic reviews. So these are kind of the core of the database. And those are, of course, full text. And we'll get in and look at those in a little bit more detail as we go along. And then the epistemonicos and central, these are only the citation information. So these are not linked. These are not the full text within this database, and they don't even, in many cases, link out directly to the full text. You would have to take that citation information and look it up somewhere else in order to get to the full text of those studies. Cochrane editorials are a few full text, and as noted, there are not too many of those. So getting into Cochrane Library. So I do have screen captures of things because we know that things don't always go as planned. And those will be shared with you as a PDF by Cynthia. But I figured people actually like to see what it looks like to go to the Cochrane Library and follow along with me. So I wanted to use an example that would be fun, that what people across the board would be likely to see. So that would be something like, like what I mentioned around smoking cessation and kind of what is the best approach to try to stop smoking, and what is evidence to support any of those. So if you want to, feel free to put into the chat box and make sure it's directed to everyone. But you could put in there, what would be the type of question, how would you phrase a question for this topic of, what works to help people stop smoking? And I'll go ahead and try put in here kind of what the type of question that people might put into Google. How do I stop smoking? So if I just put that into the search box, which is up here in the upper right-hand corner, and let it do the basic search. Oh, and by the way, I encourage you, if your monitor allows it, and you can see both the presentation and another screen, I encourage you to open up the Cochrane Library and follow along or explore it as we go, or I'll give you a chance a little bit later to check it out if otherwise. So if we put this, how do I stop smoking into the title and abstract and keyword basic search, and I get some 19 results. So there's something there, but I have to say that this is not necessarily the best type of way to put something into the search box.
Robin, there was in the chat, are e-cigarettes as effective as NRT in helping cigarette smokers to quit?
Yeah, so that's a great, really specific question that we could ask and see if whether or not there would be some information in the database, and we'll try that search in just a moment. But I just want to demonstrate that right now that there's 19 Cochrane reviews that might touch on this topic in the Cochrane Library, whereas if we try to put this search into Google, do I stop smoking? And I think probably we all agree that this is a really common type of question that people would ask and what they would put into Google. And we noticed that, there are a lot, millions of results, and the top ones are all ads, and then we get into things that, this is where probably the fact that I'm a medical librarian, I get some pretty reliable results coming up from the Mayo Clinic, but these won't always be reliable, and they take a lot of effort to kind of figure out what would be the right, what evidence would be behind those. So On the other hand, if we're specifically looking for evidence, we could try, if we just put in something like smoking into this, our search box, we can see that there's actually quite a bit more evidence in the databases that touch on smoking at all. And there are 200 reviews and some editorials and some clinical answers. And you'll notice that the sort here is by relevance. So we don't necessarily have the most recent ones here, but we have the ones that the database thinks are most relevant to the question. And of course, here we haven't put in a lot into our search, so it's just going by smoking. Also, we have the option to change how many are shown per page, and the option to change the relevant sort to by title or by most recent. The published new to old is an effective way to see kind of what's most recent evidence around smoking. And we might want to change this since we are asking this question about smoking cessation. We can see what's helpful to try just a really basic search like on something like smoking to see what is the language that's used. And that's where we can see rather than stopping smoking, it's using smoking cessation. And so that's maybe a more effective term to get to a little bit more specific information. And again, maybe want to look at that by published most recent in order to see things that are published recently. We can also see that there's some ways to filter your results on the left-hand side of the screen. We can see the ones that have been updated recently, that have new searches or have had the conclusions changed. There also is a filter for languages. So I know that at least one person who responded to the registration was asking about how much information there is in French, for example. And we can see that you can specifically filter to any language that you're interested in checking out. So, for example, if you wanted to see if support for the partner helps with, say, smoking cessation, then you could click on that link to open up that record, which is working a little hard to do because my computer's doing a lot.
Robin, quick question from the group. Is there a controlled vocabulary option?
Yes, there is. Cochrane Library uses MESH, so the same controlled vocabulary that PubMed uses. However, I'll go into that a bit more detail in the session next week on more advanced searching, because I would say for most searching, basically anything aside from searching for doing the searching for conducting a systematic review, I just use the basic searches. I don't use the controlled vocabulary. I don't love how well things are indexed in the Cochrane Library, and I find that there isn't a ton of evidence in here, and so usually one or two attempts with keywords will often get you what you're looking for. But there is the mesh, and that you can get to that from the advanced search. So I'm not going to show it much today, but I will show it more next week. Okay, so to come back to the results, when we look at a review, you can see that there's the option to switch languages, and that's done just by clicking on the language that you want, and then it will show the version in the other language. However, not necessarily the entire review is translated in the other languages. In this case, we can see that the abstract's translated to French, as well as the plain language summary, but not the rest of how the review was done and the methods. I do want to jump to the plain language summary. So for those who speak French, although I can switch back to the English as well. This is one of the really big strengths of the Cochrane reviews, is that they've made a really big push to take what is, hundreds of hours of work and often hundreds of pages of reporting, and synthesize that down into something that is meant to be understandable by anyone. And so they try to, I think they aim for grade 5 reading level, possibly, although it could be grade 8, I can't quite remember. but they're not using clinical language, trying to use language that people will understand, no matter what your background is, and they give the kind of the brief version of what they did in their study and what they found. So the key results is basically in this review that only one study reported it improved. And there's they also show the quality of evidence. And the implications of practice is basically that this isn't super helpful. They didn't identify any changes. So this is useful if they're for clinicians, if they're thinking they should recommend this, or if people are trying to convince their partner, maybe it's not actually the place to put your energy is to have a partner get that support. So here on this record, there are ways to jump around to different sections of the review. There's also an option here a way to export the citation, to pull that citation information, or to export it into a citation management software. And I think I get to this a little bit later, but maybe I'll jump to it now. One of the no, I'm going to show it later, sorry. One of the things I find helpful about Cochrane Library is it's easy to get to some of the figures that help you understand what the results are. But let me get back to my slides so I can make sure that I'm on track with what I wanted to say. And language summaries. Right, so this is what I wanted to show. This is a different review. But what I wanted to demonstrate in the search results is if we took this general question, which is just kind of a condition or like something we want to accomplish, you'll get fewer results and something more specific to your question if you did something like if we wanted to try the question that was posed by somebody in the group, which is e-cigarettes, and nicotine replacement. Let's see. I haven't done this search. Pharmacological interventions to reduce harm from continued tobacco use. So that would likely touch on e-cigarettes. So now we're getting to just a couple of reviews and some trials once we're getting a much more specific question. And the question I'd posed was, I knew that naltrexone was used for alcohol dependence, but I wasn't sure whether or not it was used ever for helping people stop smoking. And so I'd looked up opioid antagonists, which is what naltrexone is, for smoking cessation. And what I want to show from that particular review is that this is one of the figures that's presented is a way that I find that as a non-clinician that these figures are helpful for getting a quick understanding of what's kind of been done in the review. And so what essentially this is each of the studies that was included in the review is kind of summarized visually with the estimate of effect as the dot on each of these lines. The vertical line is the line of no effect, where they can't tell whether the intervention or the control was helped to get to your outcome, which in this case would be not smoking abstinence at the longest follow-up. And then there's a summary of all of the studies in the shape of this diamond. And we can see that this diamond is right on that line of no effect, both for naltrexone versus placebo, and also when it's naltrexone combined with nicotine replacement therapy. So we can see quite easily, quite visually, and I'm a fairly visual person, that and that aligns with the summary that was given in the plain language, which is naltrexone. There isn't really good evidence, or it doesn't seem to indicate that naltrexone helps for smoking cessation. Whereas when I look this up for naltrexone and for naltrexone for alcohol dependence, we can see that in this case, this is looking at the outcome of how much people drank per drinking day. We can see very clearly that the diamond is on the side of favoring the intervention, the experimental. And so even though the individual studies are kind of all over the place and it's hard to get a sense looking at those, but when the researchers did the statistical compilation of all the results, we can see that it does help individuals who are trying to avoid alcohol. And so this is what a systematic review really helps with, is that it does help, it combines the results of multiple studies, and also these studies have been assessed for how well they've been done, and so we know that they're good studies, and then you can have more confidence in the results than you can from a single study.
And Robin, you got to that screen by clicking on that figures?
Yes, so if I go back, yeah, and thanks to Cynthia for pointing out that the MESH is medical subject headings. And somebody has commented that in the plain language, based on the language used and the word size, yeah, grade 8 is probably accurate. And I would not be surprised if that's true. Even that, I find that, so reading some of the reviews, the plain language summaries, I'm not sure they actually get to that level of reading, but that's the aim, is that they're trying to make it readable for folks with, maybe a high school education. Yeah, so figures and tables, in this case, it depends on how many figures and tables. Sometimes you have to scroll to it, but yeah, in this case, this is one of the first figures that comes up. And so you can see that. One thing that's important to note about, if you do look at these, what are called forest plots, make sure to always check the favors control versus favors treatment, because that switches sometimes even on the same study. In this case, they're both on the favors treatment is on the right, but not always, that's not consistent. So you always need to read the legend to make sure that you're interpreting it correctly. So I want to give you guys a chance to open up the Cochrane Library if you don't have it open already, and just try some basic searches with either these topics or something that maybe has come up for you at work, or a question you are interested in, keeping in mind that a specific question about a treatment for a particular condition is going to work best, and keep the language fairly simple, and you can use and in between things, but the default is it's going to combine by and. So even if I put in common cold zinc, it's going to combine things, combine those two things with and by default. So I'll give you a moment to explore that and explore the results that come back from any of those searches. And yep, Cynthia's added a link to the Cochrane Library into the chat box. And maybe anyone finds out the number of reviews that are for the common cold and zinc. Throw that into the chat box. If you find an answer to any of your questions, put in what question you put into the box, and maybe how many Cochrane reviews or other types of evidence you find from your search.
Quick question, Robin.
Mm-hmm.
So you could change the interface and the search interface up at the top by just clicking on that drop down and choosing whatever English, or looks like it only does Spanish at this point. But can you type in type searches in those languages? Say if your interface is set to be French, can you type the search terms in French, or does it have to be English search terms?
I believe it has to be English, and as you noted from the dropdown for the interface itself, I think that they don't have the interface in very many languages right now. It's just English and Spanish. But I noticed, I was looking in here, and yeah, even not all on all the pages. Like if you're looking, for example, I'll get this in a moment, but if we come back to our search results, let's go to a different broader search.
There was, oh, sorry.
Yeah. Anyway, it doesn't change. It doesn't change all of the page. Basically, that drop down.
Okay.
English, and it's so the things that are specifically in other languages are the parts of the Cochrane reviews in specific, and those are noted. It'll be noted on the side menu which parts of it are in whichever language you're interested in. Yeah, but that's a great question.
Kathy had a question. Kathy Chisholm had a question about. Well, actually, a couple folks did. When it says that the review has been withdrawn, what does that mean?
Right. So that's a great question, and part of the reason I put that example in there. So often that means that it just hasn't been updated in a really long time. And I think that that's what that means in this case. And so 2015 is not that long, but I think when I looked at this, I had that same question. So 2015 is 4 years old. But what I noticed when I looked at the Cochrane protocols is that there's a new review that's basically the same question that's being in the works, that's being planned. And so there's not always a really specific answer on why it's been withdrawn, but my guess would be in this case that the people who had been working on it didn't want to continue updating it. So a new group has said, okay, we'll take this on, we'll make a plan to do this, but we're going to start from scratch and we're going to do a new review looking at this question. So that's my guess here, is that that's what's going on, because when you do a Cochrane review, you're kind of married to it for life. So I'm an author on a recent review related to post-operative nausea and vomiting, and I'm committed for forever until I, actively give it up to keep doing those updating those searches and making sure that we add new evidence every year or two to our results and our conclusions. So we have some comments in the box, the chat box. Some folks found Cannabis and Pain gets 5 reviews. Low back and exercise gets lots of reviews, and I think that they touch on different types of exercise, like Pilates and different things. So when you have to go into the, let's see, this and pain. So somebody said none of the cannabis pain reviews have figures available to see. But if, for example, we went into this one for cannabis-based medicines for chronic neuropathic pain in adults, so that would be like pain like from shingles or different types of things that can cause neuropathic pain. So we scroll down to here. Here's our figures and tables at kind of the bottom of the right-hand menu. And in this case, there are a number of different figures, including these colorful ones are the risk of bias that has been assessed. But we do get to some of the forest plots that show the summaries of the individual studies all combined up.
Robin,
yep.
Just a note from the chat that if you go into that withdrawal notice, apparently there was a notice, it actually says for that cold and zinc, the common cold and zinc, it says it was withdrawn due to plagiarism of both text and data.
Ooh,
That's what Allison Manley had found.
Thanks, Allison, for going into that. That's exciting. That's more dramatic than what I thought. So yeah, so that's handy that they provide that information about why things are withdrawn. And so that would be a very good reason to withdraw things. Often it's for the reasons that are a little less dramatic and more just that they haven't been updated. So you're finding that's not available at your search. So the person who just said that, I could allow you to share your screen, but then we might get into messiness. It's possible, are you on a different type, did you select a different type of results? Because if you're on a different tab, you won't necessarily see those figures. For example, well, this one doesn't have any Cochrane protocols, but they don't always have, it's just the Cochrane reviews that would have those figures. And you do have to click into the review. And as a note, sometimes, certainly on my pages, the reviews do show up on a new tab. So it might even be a new window depending on your browser. So I don't know, yeah, if you can explain what part of it isn't not able to access the figures. So are you able to, for those folks who can't access the figures, are you able to access the review itself? And if you have a microphone, you're welcome to unmute.
For those that see a lock symbol, that is because your IP that you have been assigned that day from your ISP, if your internet service provider, is not one from the Atlantic region. This randomly happens. We've discovered through trial and error that some of the internet service providers in the maritime, in the Atlantic region, assign Quebec IPs to.
Yeah. So even if you're in Antigonish or anywhere across the Maritimes, it's faded out, but that's probably what's going on there, is that
you're assigned an IP by your service provider, and sometimes that can be one from Quebec. Unfortunately, that's not something we can control. Yeah, basically it's not Atlantic. It's basically your Cochrane is not recognizing you as coming in from the Atlantic region. In that case, the only way you could potentially access it is to go in through whatever your home institution is and authenticate through their access. So I'm not sure, is it Sandra? Yeah, unfortunately, I'm going to be talking to the service providers in the Atlantic region about this because as far as I can tell, they've included Quebec with the Atlantic region in terms of the stable of IPs that they will assign their customers. So I need to talk to them about the implications for this on any regional deals that we do where it's based on GeoIP, which is becoming much more common. So just if you run into that problem where you see that little lock symbol, that means it's not recognizing that you're from the Atlantic region. And I can also, I'll put an address in here. There is a resolver that you can go to, and it'll tell you where it thinks you're coming from. Just in case you want to verify that that is indeed the reason and not some other reason. But in that case, you'll have to go authenticate through whatever home institution, whether that be a health authority, a university, whatever is your home institution. If you go in through their system or the public library, because the Halifax Public Library definitely has it up. I haven't checked all the other libraries, but it will have it there and you can go in through it there as well. So apologies for that. So that is, but in one way, I'm glad it did come up so that I could explain it to folks. It is a random thing to do with the service providers, and it's not specific to any one service provider. I found it on TELUS. I found it on ExploreNet, Kudu. It's random. Unfortunately, they all seem to use Quebec in their stable of IPs for the Atlantic region. And some days I can get in, other days I can't, and I have to authenticate.
So here's an example of Halifax Public Libraries on the health resources. We've got a link to Cochrane Library, and that's going to prompt me to put it, well, actually, in this case, it's just going to go in because I'm here, I guess. I guess it doesn't require that though it might if you're outside the province.
So if you're in Antigonish, hopefully, because Nova Scotia has been pretty good about setting up this access, you should be able to go in through your local public library site to access it. Or if you're at St. FX, you can go in through the St. FX database portal, and they should have it listed there as well.
Right, so, and just logging in again can do that as well.
No, it's not Ile de Madeleine. I've actually been assigned sites in just the mainland Quebec as well. Saint Maurice and some other places. It seems to be very random.
Yeah, so yeah, that's great chance to explain some of the weirdnesses that happen with internets and this particular deal with the geographic issues. And so hopefully those explanations also help if your users run into these problems, if people expect to be able to do this, if you know that that's what's going on, then you can explain, you can try logging back in to a new browser or go in through your institution. So just to come back to kind of what I've covered so far, I've got another little poll to check whether you're paying attention, and hopefully people can see this poll. This question of what types of records in the Cochrane Library provide direct access to the full text, and you can select more than one of these. So full text ones. Are folks seeing that okay? Yeah, there's some answers coming in. Sorry about the ringing phone. That's your timer.
And just a note, I put the link to the IP location resolver. So if you go to that, it'll tell you what IP you have and where it thinks it's coming from.
Okay, so we've got a bit more than half folks have responded. And so to show those results, most people identified that yes, the Cochrane systematic reviews are in full text. Central clinical trials, so I don't know if you took a chance to click on those, but I haven't shown it, but I did mention that those are actually not full text. Protocols are full text, other reviews are not. Clinical answers are in full text, as are editorials. So let me let's see, I think I've touched on these things. I'm going to skip forward to other results. So this is a screenshot of some of the clinical answers. So this is that cannabis based medicines for neuropathic pain. So what's kind of helpful about this this format for these answers is that it pulls out particular outcomes and gives that evidence. So for example, for sleep problems, and it pulls out that forest plot, that relevant forest plot from the review, so that people can quite quickly use this as a way to understand what is the underlying evidence. And so this is important because the overall or the review might say, no, it doesn't help with certain outcomes, but maybe it does help with some other outcomes. And so if somebody has a particular concern about sleep problems, then it's worth looking at. Conversely, I don't have a screenshot here, but if you were to go to psychiatric adverse events, the forest plot on that shows that cannabis is associated with an increase in psychiatric adverse effects. So if you have somebody who's concerned about those particular outcomes, then it's a really easy way to get to that type of information to see what the underlying evidence is. And again, making sure to note on the forest plot which side is the intervention, and in this case, that's on the right side of or the left side of the the forest plot, and on the right is the control, or the comparison to placebo. And we've got this final estimate of effect of all of the studies is favoring cannabis for in the case of sleep problems. So I'm not going to get into the details about kind of what that statistical significance means, or what or how much of effect. I just use this as a general reference to get a sense of the evidence. But there's a lot of information here, as you can see, a lot of things about heterogeneity and specific statistical results that you could get into. I can explain if needed at another time, but for many people that we're working with, just having a basic understanding is kind of what we need to make sure we are confident and we can help to communicate. So, and this next one is looking at the results from clinical trials. So let me go back to the trials here. If we click on the tab for trials, we'll see that we get to a listing. Again, the default is by relevance, but you can change that to most recent if you want, or oldest, I guess. I don't know why you do that. But, so these are individual studies, and they come from, you can see this one is both from PubMed or Embase. And there are a number of them that come from the clinical trials. So these are registries of trials that are underway. And the links for those go to basically just the abstracts, but not the full text of any report of the study. There's information about the citation and information about the abstract, but not a full text link. Here's a result that's diabetic neuropathy. And again, eventually, we can see that we have an abstract, we have citation information about the journal that it's from, the date of publication, the authors, and there is a link, a DOI link, but there is not full text.
Question for you, Robin.
Mm-hmm.
If you were at an institution that had access to Journal of Pain, would that be somehow linked? Could you link to that? No, they don't link?
No, I mean, the DOI link will,
okay.
If there is a DOI link, that may get you to the full text. So in this case, yes, for me here at Dalhousie, that links me directly to the record. And because I'm on campus, I have access to, I could download that PDF. Not all of the records that I've looked at have that DOI link. But if they do, then that would link you directly if you were at an institution that had the access. Otherwise, you would need to maybe copy that title over and pull it up in using whatever your own preferred way to get to full text is through the subscriptions at your institution.
Thank you. And there's another question in the chat.
Mm-hmm.
Do you know if all or other systematic reviews included in the Cochrane database?
All the clinical trials and trials are ones that are included. So that's a good question. I believe, so there's been some various effort to make sure that all of any included studies from the individual systematic reviews do get into Cochrane. I'm not 100% positive that 100% of them are in there. I know that there have been efforts to go back through the backlog of Cochrane reviews and make sure that those records are in central. But that is a good question. Certainly in terms of prospectively, if you were conducting a systematic review, depending on the topic, it is very likely that many of them would be in Cochrane Central. But again, there's no guarantee that these are being pulled from PubMed and Embase, which is where the majority of clinical trials are going to be published, and the addition of records from the trial registries such as clinicaltrials.gov and the International Trial Registry means that it's very likely that it captures a lot, but I don't know at this point that there's been studies to demonstrate that it's it would be a single comprehensive place to look. And depending on your topic, the review topic, there are other places that you would need to look. So that's a long answer and not a very clear one, but I would say it's very likely, yes, but I wouldn't say that it's 100% at this time. That's not something that they promote as being one thing that something that they've accomplished at this point.
There's another question in the chat. Is there a way to directly export a reference to a reference manager to manage studies you'd like to use? So I assume this record, is there a way to?
Right, so if you're on an individual record, you can select export this central record. And again, you can export that to a citation management software. You can do a direct export or download it and save it in different file formats. And this is new with this new interface. Or you can see that the record is there, the information about the record. And that is true of the trials as well as the Cochrane reviews have that option to export. If you want to take a whole set of studies, you can have the option when you're on the results page to select all or select however many you want to select and then export those as well. And so you have the same option to export sets of articles as you, just like you could an individual one. And that's true as well on the trials. We wanted to select either a few or all of these and export them. Then that can be done. And you do need to, if you want the abstracts, make sure you select include abstract, and then you download that and it creates a text file. So that's how you do that. Thanks for asking that. Let's see, and yeah, here on the note that the filter options do change depending on which tab you're on. So for example, here on the trials tab, you can sort by which source it comes from, whether it's Embase or PubMed. It doesn't have a tab for the trials, but from clinicaltrials.gov, you can sort by the dates that things were added. Whereas here, the options, there's a few more options, including languages, the types of questions, and the topics that are covered. You can filter. And I showed a screen capture, but here's the what the record looks like for clinical answers for this particular one, which is the only result for the search of cannabis and pain. And so it gives this brief summary, the clinical answer, and then also shows the comparisons for these various outcomes. So here, when we look at the psychiatric adverse events, it gives a quick kind of synopsis, a narrative result, and then also shows that forest plot for that particular outcome. So I think that covers, oh, and we're past our time.
Mm-hmm. No, that's, no.
So I'll just end things with a chance for you to, one final poll, to, in your opinion, based on what we've talked about today, what user groups do you think that you work with might benefit from knowing about and using the Cochrane Library? And if people don't have to run away, which I understand if you do, you can go ahead and answer.
And just while folks are doing that, I just want to mention that I did post into the chat a link to a support page where I've brought together a bunch of training materials, where research guides, webinars, tutorials, things like that, and also marketing material if you want to market to your user groups. There's logos and there's banners and things of that nature, and there's also some posters if you want to use those in your marketing campaign. If you'd like more information, or if you'd like to use things in a different way, or ask some questions about anything related to support and marketing, just contact me. I should probably put my email in there. There we go. But otherwise, I've posted a link to those support materials in there. And also the link to the resolver to tell what geographic region it thinks you're coming from.
Okay, and the poll results are in, and it's great. I agree with many of you who've said that health professionals and medical trainees are going to be a really, folks who are really going to benefit from this resource. But yeah, all of these people, all of these various groups could probably use it at certain times, and so I hope that you will all go forth and consider it as a possible source to help answer reference questions or help users to easily access this information. And one of the benefits of this is that the information is fairly clearly presented, and there's relatively little. So as opposed to searching something like Google or even PubMed, you don't have to be super sophisticated and still be able to get some relevant results if they're there. However, there isn't necessarily an answer to every type of health question in this database. And I think that that's it for me. Thank you so much for your patience and for your engagement. And I welcome any questions directly to me about using the Cochrane Library, as well as the contacts that Cynthia has posted there.
Yeah, and also I did post the address to our webinar page. I'll be posting the recording of this session after I receive it from Robin. And thank you so much, Robin, for doing this session for us. It's fantastic to get an overview of Cochrane, especially for those of us who are not familiar with the health sector and are not health clinicians or anything of that nature. That was very useful to learn what we can do with it, as well as those who might be in the health sector. Thank you.
No problem.